Well, a public health physician from the Lagos State University Teaching Hospital, Dr. Toni Adeyemi, joins me live now via Zoom for more on the importance of breastfeeding. Doctor, an entire week to celebrate breastfeeding. Why is it so important?
Breastfeeding is really important, and we even need more than a week to actually celebrate it and create awareness, because we're having children every day, and it is very vital for childhood growth and survival. As earlier mentioned, it protects these children against childhood illnesses, two of the most fatal that are responsible for the highest causes of childhood death, maternal childhood morbidity and mortality: diarrhea and pneumonia. So it's actually very important, because it's not just the woman we're focusing on. We need all the actors involved. We need to send these advocacy messages to the government, to the health sector, both the formal and informal health sector. We need to send those messages out even to workplaces, so that we can have enabling workplace breast policies that support breastfeeding. We need to get this message out even to our lawmakers. We need to get this message out to as many people as possible. So we need a week to actually get this message out to the public.
And the theme for this year is really supporting that. Step up for breastfeeding, educate and support. Talking about educating and support, how would you say we can create safe spaces for nursing mothers? Because, of course, breastfeeding should be an intimate experience.
How do we create what spaces?
Yes, safe spaces for the nursing mothers to be able to breastfeed the baby. Because, you know, in the community today, depending on the nature of job of the individual, sometimes you're on the bus, you're on the street, and there are eyes staring at the mother while she's breastfeeding.
Yeah, so that's why we need a lot of advocacy, because the woman alone cannot undergo this task of breastfeeding her child. So she needs a lot of support from people around. It starts, first of all, within the family: a supportive husband, supporting children. Then when you get to the community level also, there should be stigma against women bringing out maybe their breast to breastfeed out in public. And there should also be enabling environment. There should be a supportive physical environment and built up environment, such that even in public spaces you have rooms designated for nursing mothers. In workplaces, it should be mandated that every workplace should have a room designated for nursing mothers, because, as you mentioned, the WHO recommends that the first 6 months the child should be exclusively breastfed. Then after 6 months, breastfeeding should continue up to 2 years of age, such that even when the woman returns back to work after 6 years, or if she has to take her baby around with her, there's a place at the market. We should have spaces, clean and safe spaces, where these women can adequately breastfeed their children. These are some of the enablers, some of the things that would ensure that we have more women breastfeeding their children for up to 2 years, and especially the first 6 months of life.
All right, but Dr. Adeyemi, it's not unusual to hear some women say they are not lactating well enough. What would you say to such mothers?
Okay, so there's really no situation as not lactating enough. Fine, I know it's a reality. Some people say that. However, the way the breast milk mechanism goes, the more you put your child to breast, the more the child suckles on the breast, the more you initiate the whole breastfeeding, the breast milk production. So you need to, if a woman is not lactating well enough, she needs to put the child to breast more often. And all this education actually starts from the antenatal period, such that, because we know that some of these challenges could actually occur, especially among first-time mothers. So we have health education talks during antenatal. In other climes, we have things called, people called breastfeeding or lactation consultants. So they help walk the woman through this whole breastfeeding period, because breastfeeding would definitely come with a lot of challenges, especially for first-time mothers. But yes, a woman not lactating enough should keep her teeth, and before long, the breast milk will start flowing out properly and flowing well, actually.
Well, Dr. Toni Adeyemi, thank you very much for educating us on this topic tonight on TVC News at 7.
Thank you for having me.